Good morning, everybody. Doc Dave here in episode number 45. Today I'm going to be talking about a somewhat esoteric, but if you have yourself or family members or friends exposed to this type of therapy, it's always good to have a little knowledge and education about it. So today we're going to talk about radiation therapy. Now, what is radiation therapy? It's a cancer treatment using high ionized energy X-rays. And it's particles that can kill the cancer cells. So you have this highly ionized material, and we'll go over later what the materials generally are, but usually it's an electron beam from a linear accelerator. And it's in the lab in the hospital. It's not like the linear accelerator at Stanford University that's like 2 miles long. These are portable linear accelerators, and they emit these electron beams, high intensity, highly ionized beams. And it goes localized to where the cancer is, either in your head or neck or extremities or abdomen or lung. It can focus in and go in there and kill the cancer cells. Now, it kills the cancer cells by disrupting their DNA. It breaks the DNA down, fractures the DNA so the cell dies and can't regenerate. Now, you may be asking, well, what does it do to normal cells? Well, it can also affect normal cells, and it can kill some normal cells as well, but the beam is highly localized and focused, so you're not just spreading all over your body. And the good thing about healthy cells is they regenerate after a short period of time, unlike cancer cells. And so they can resolve and come back to normal cells within a relatively short period of time. Now, what types of radiation therapy are there? Well, there's 2 types, and there's a third, but it's very rarely used. The most common types are, and the most common type is external. It's a beam radiated from the linear accelerator. So it's an external beam. You lay on a table, it's like going and getting a CT scan. And the beam focuses on the area that it's shooting the electrons and highly ionized X-ray beams. Then there's something called internal. Now, this is for different types of cancers. Most common is prostate cancer, where the radioactive material is inserted in the body next to the cancer cells. That's why it's so common in prostate cancer, because you can insert it right into the prostate. And there's a third one called a systemic radiation, where if you have like extensive cancer cells that are spread through the body and they're not focused, they're not localized, you can't use the internal, can't focus on the external because it's too localized, then you use something called a systemic radiation. And they insert it into your bloodstream, the cells into your bloodstream, and it can spread throughout the entire bloodstream and kill metastatic cancer cells that have spread from the primary source. Now, the mechanism of action, I don't want to get too detailed in this, but we kind of touched on it above, and like I say, it fractures the DNA of the cancer cells. It also does harm some healthy cells, but they regenerate better. So, symptoms of radiation treatment. Okay, so you're lying there. Let's say you're getting external treatment, and you're in the machine, and it could be anywhere from 5 to 30 minutes is the duration. And usually it's totally asymptomatic. Patient isn't feeling, kind of like going and getting a chest x-ray or any other kind of x-ray. You don't really feel anything. Now, afterwards, you may get a little skin irritation like a sunburn, but that's pretty much the extent of it. You don't get the nausea and vomiting like you get with chemotherapy and all those internal systemic symptomatology. So you're in, you get your treatment, 20 minutes, you're out, you can drive home, you're not under any sedation. You can be around family members with the external radiation. You're not going to spread any radiation. You can sleep in bed with your partner. You can be around your children. Although they always say, for a few days, avoid being around pregnant women and really early infants. But otherwise, it's pretty normal stuff. You over the course of time, you will lose a little weight, usually anywhere from 7 to 8% of your body weight. But, that's nothing, terribly drastic. So, the effectiveness, it's highly effective in killing cancer cells. And depending on what kind of cancer you got, where the cancer is located, how it's being treated, either external, internal, or systemic, it's generally very effective. But you can combo it with chemotherapy and surgery if necessary. If you got a very extensive cancer, like a lung cancer, they're going to remove the lung, and give you chemo and give you external radiation treatment as well. So it can be comboed up, but as a rule, if you catch your cancer early enough and you're a healthy individual, external radiation is generally all you need. And like I say, it's very effective. And even specifically HPV squamous cell carcinomas are, they say, 95% resolved with radiation therapy alone. So that's obviously good to know. Okay, now you got to be patient because it does take some time for the cancer cells to die. So you're not going to just get one treatment. You got to go in there at first, quite often, whatever schedule they set up for you, but you're going to be in there, for the first month or so, quite frequently getting the external radiation treatment day after day sometimes, and, because you have to keep after it. It's like putting out a fire. But if you still have smoke afterwards and embers, the fire's going to come back. So you got to be really aggressive with this and get it taken care of once and for all. Now, so that's pretty much it. I don't want to go into detail in the types of internal, radiation material that they use. I'll just say, there's something called iridium-192, cesium-137, iodine-125, and cobalt-60. That's for internal, when they place the rods right next to, the prostate, for example. Shield, they use a lead shield so that you don't get exposed to all other organs in your body as much as they can, and they use a dosimetry badge for monitoring radiation dosages. So that's pretty much it in a nutshell. Thank you for your time and listening. I hope this will help answer questions for people or family members or friends that are going through radiation therapy, because it's quite common and it's very frequently used for a lot of cancers. So now you can share this with family members or friends or coworkers or whatever, and this should be very beneficial and educational to them. So thanks for your time, and we'll see you again soon for another episode. Signing off, Doc Dave. Remember, I am your friend, not your doctor. So always consult your doctor with any further questions.